GLP-1 community, I really need your advice. I'm also realizing in this moment I look quite heinous and need to brush my hair, so that's what we're gonna do. So here's the thing. When I started the podcast 2.5 years ago, when I started creating content in, what was it? I guess July or so of, maybe, no, I guess it was October of 2022, you know? Well, that's going back in a ponytail. I really didn't know what I was doing. I was like, I'm just going to show up. I'm just going to say things. I'm going to try to find a way to kind of blend these patient stories, right, with what these doctors are saying. The reason I set it up like that to begin with was because I knew I wanted to change things. And I knew where we were as a society was if we had a podcast where all we did was talk about our journeys, frankly, anybody that didn't have obesity or any issues with weight would look at that as, and this is going to hurt, but trust me, it's a society thing, as fat people whining. Do you know what I'm saying? Lazy, unaccountable people whining. I knew it. And so I knew we needed to make sure we had our powerful stories on, combined with the facts, science, and data from the doctors to validate those experiences. I knew it. And so that's a lot of what the podcast does, right? That's why it's long. That's why you got to be a long form content person to really like it. You got to be a podcast person to really like it. But that is the goal. And I always knew that it was, actually, I wouldn't say I always knew. In the beginning, I did not know that it was a movement. I just knew we needed to get loud. I was hoping that we could change things, but I had no idea what changing things would look like. At some point when the doctors were on, I recognized that what would be the key thing to change would be actually getting this on Medicare, because Medicare sets the standard for basically all of the commercial health insurances in our country, And with the recent news that Medicare is likely going to cover it, I'm wondering if I'm done. Is this it? Right? That's the kind of thing that's going through my head. Have I done what I hope to do? Have I moved the needle that I hope to move? What will continuing to have the podcast, continuing to make content on social, what am I trying to achieve? What needle am I trying to move? Now, I'm a product marketer, so we're always thinking about how we move a needle. And then it dawned on me, and I'm not sure how to solve for it, and that's why I'm sending you this video. Millions of people are about to get access to this medication. Millions that couldn't before. And while that's great, we sure as hell do not have the infrastructure from a patient support perspective and community perspective to be able to help them through all the things that we know they're going to need help with. And when I was at Obesity Week, I actually asked one of the doctors on the panel, I said, as you're trying to change the system, right? As you're trying to create a obesity program in the same way that you have a diabetic program, because there's not enough doctors, not enough clinicians, not enough experts to be able to treat the amount of people that have obesity, right? As you're doing that, are you thinking about patient trust? Because here's the thing. At the end of the day, your PCPs and stuff, they don't know enough. The majority, I think it's getting better, but it's still not great, right? They don't necessarily understand this disease and how to treat it because it is very complicated. And people continue to think that it is just about the fact that we eat less. You know what I'm saying? There's just so much more to it than that, right? And they don't understand. And they don't understand, when you stall on these meds, they don't necessarily understand when you have I would say side effects on these meds. They don't necessarily understand how to treat them as opposed to just pulling them off, or if someone vomits, or how to adjust the dose. And there's so many little things like that. Or when people just don't want to eat at all, what about I do the 3-bite rule. That's how I do things, make sure you re-engage your brain, right? And I just don't think they know those things. So how do we solve for this, guys? Clearly, Dave and I have podcasts that are ranked in the 1% of podcasts in the world, right? And it's all about this subject. He does a different thing than I do. I do a different thing than he does. Sometimes we kind of bleed our stuff together. We are very good friends. We are advocates. And I think that is the springboard for anything that we could possibly do are the things that have the most traction, and everybody else raising their voices and building more podcasts like this. It's excellent. We are taking over literally the health podcast in this country, if not the world, which is fantastic. All of us. When I say we, I mean everybody that's got a podcast. And if you don't think I want you to have a podcast, you don't know me. You don't know me. I want you to have a podcast. Everybody. How are we going to solve for this? These millions of people that are about to get access quickly. Like literally starting, if it all works like it should, in April, and then it's going to trickle down to insurance companies. How do we do this? Because what insurance companies are going to do is, in my opinion, is they are going to put guardrails in place, which is basically making you like take pictures of your food and get on a scale every day. And clearly, like, and I'm sorry, but many of us that have had obesity for a long time and lived in a big body in a society have a lot of trauma. And so my concern is that they think it's accountability and guardrails and taking care of you and all this other shit, but there's so much more to that. And I think that we can all agree that the majority of the support that we have gotten on this journey has been here in this community with each other, right? And that is because we, for the most part, don't trust them. Even the doctors that are prescribing the medications. You will come here on a live and talk to me and others before you will talk to them. And I'm concerned that we need to, in my opinion, really heal that relationship between clinician and patient for trust to be able to move forward. So I want to be part of the solution and not the problem. And it's very easy when I see people that make like anti-GLP-1 content to like not just ream their asses, but I'm trying to be part of the solution and not the problem. And the solution is having commentary about that and doing it in, I think, the kindest place of good intent and education as possible from a patient advocacy education perspective. Ultimately, sorry, I burped, I just had my protein shake. Ultimately, I'm not a doctor. None of us are doctors. Well, some of us are, or clinicians. I'm not, but I will tell you, like, this is an incredibly complicated disease and we are barely offering the type of support now that is needed for this, not just to, guys, not just, think bigger, not just to lose weight, right? But to keep it off, like to get to these lifestyle changes, which we've got to find a new word. I don't like the word. Like, but just, I think living whatever your healthiest life is, right? Whether that's everything in moderation, whether that's whole foods, whether that's exercising at the gym, whether that's exercising in your neighborhood, or whether it's lifting weights at home. I don't know. I don't know. Everybody's different, right? But I feel like that there is this massive gap in support, in patient support and connection and community that is not there. I am not sure this is going to be able to handle it, especially if it goes to America like it's supposed to. I don't know. Like, I mean, I think we can all agree this has kind of become a trash app. Like, they don't let us talk about our stuff, but I don't know how to fix this. And I feel like we have pieces in our community together, right? All of our podcasts, our platforms here, our platforms here on other places, that we can find a way to work together. Because if you think about it here, like our lives, especially like us in the beginning, so like there are lots of people from the beginning, our lives became blueprints, right? And everybody could take that blueprint and then apply their own spin to it, right? And then be able to help people without giving medical advice. This is the important part, right? But ultimately, I think it's fine for us to be giving advice as patients and as a community, but we should find a way to be able to push this back on the clinicians, because I don't think they even worry about doing it because the patients are getting it here. You know what I mean? And it's fucked up, but we know more than they do, So not all of them. I'm not talking about obesity specialists. I'm not talking about endocrinologists. I'm really talking about PCPs, like in general care, but they're the first line of defense. So that's where I'm at. Like, I feel like we've got to find a way to fix this. And I think that we have the parts and the pieces to do it, but I'm not sure how it all comes together. And I want to know what you think, because if anybody knows me, they know I want to get loud and change things. We did get loud. We are changing things. Things are changing. They're happening faster than they would have ever happened if it wasn't for us, if it wasn't for you. That being said, how do we get on the other side of this? How do we help all these people that are about to get on this medicine? Because I'm not going to leave it in the hands of the traditional people, because I know they don't know shit. So what are we going to do? Tell me in the comments. Send me a DM, whatever. Love you.